In December, Medair mobilised a team to undertake some assessments in the eastern states of Sudan in response to the Tigray refugee influx. What we found was astonishing. One of the camps is called Tenedba, and this is where Medair is focusing our intervention. During one of our visits, we met a young lady called Laya, who had recently given birth to a child. She fled Tigray after violence. She spent about 2 months living in Hamdayet under appalling conditions, but in January she was relocated to Tenedba, and 4 days before we met her, she gave birth. For people like Laya and the other 20,000 people living in Tenedba, it's a rush to provide the basic services they need to survive the rainy season, which usually starts at the early part of May and continues through to July, August time. There were more than 60,000 refugees still living in very, very basic conditions with inadequate healthcare, inadequate sanitation, limited water supply, and looking at a concerning situation with the rains coming. Medair are seeking to set up a primary healthcare service along with nutrition services for a population of about 10,000 people. In addition to that, we want to complement our healthcare activities with improved sanitation, environmental health, hygiene messaging, and improved shelter and settlement planning to counteract the threat of the rains and the extreme climatic conditions. With temperatures peaking at about high 30s, even 40 degrees centigrade, the absence of shade, I think the discomfort for the population is enormous. To then swing 180 degrees and then have extreme rains, which is going to cause flooding and access challenges, I think Tenedba is going to become one of the least hospitable places in the world.